me put this into the presenter mode. And again, thank you for your patience and for joining us here today. My name's Christy Cox, and I'm a volunteer with Chronic Pain Partners with John Furman, who's on here. Chronic Pain Partners is a nonprofit 501c3 that's been around for several years. And John and a lot of volunteers and board members from both the medical and the patient community have made a huge impact in the awareness and the knowledge, the education, and things that they've done for the EDS community. So let me get started and give you a quick intro. So one of the things that John and his volunteer team have done is they created a big conference a few years ago that premiered training and education for people on how to lead EDS. And so that is still available, and I will show you the URL in just a moment. And then another great thing is there's a program, and this is free, and so is the Lead EDS, where nurses can go through an educational program designed to help them better become aware and understand how to recognize and treat patients with Ehlers-Danlos. So again, I'm going to switch here, and feel free to take a screenshot if you'd like. This is some URLs to both that nursing program, the Lead EDS program, and of course, if you're not already subscribed to our newsletter and are not aware of the hundreds of other webinars that we do and book reviews, it's all available on our website at www.edsawareness.com. So before we get started, just want to make sure that you're aware that these are our disclaimers, and we have no conflicts of interest. So let's get to it. Welcome to today's topic with our esteemed guest, Susannah Fox. And this is a little bit different than Chronic Pain Partners' typical doctor educational series. And today we're going to talk about exploring patient empowerment and some of the ways that Susannah has shared through her book and through her work and her past experience about how the power of community and technology innovation can come together to be a health catalyst, leading, what she calls a patient-led revolution in healthcare. So before we get started, I wanted you to be aware we are going to take live Q&A, but we're going to do it through the chat feature and not the raised hand feature, so that we can be, more efficient and answer more questions. And so at any time that you have a question, please feel free to put it in the chat. And at the end, I will moderate that for Susannah to be able to access it. So meet Susannah Fox, a health and technology strategist, and her book, Rebel Health, a field guide to the patient revolution in medical care, was recently published by MIT Press. She has quite an extensive background that brings her experience to this as a former Chief Technology Officer for the U.S. Department of Health and Human Services, where she led an open data and innovation lab. She's also served as the entrepreneur in residence at the Robert Wood Johnson Foundation and directed the health portfolio at the Pew Research Center. So her experience from her career and her own personal experience in her family as a caregiver and a patient advocate gives her great credibility for the research and the writing that she's done, where she's grown and gotten very involved in this community movement. So we thank you so much, Susannah, for being here today. And I will hand it over to you in just a moment as we go through this empowering session. Again, here's the website. Here's a screenshot of some of the free programs that are available on our website, including several key brochures and resources. So Susannah has done a great deal of research, and I pulled a little bit here today as evidence of what she's going to talk to you about today, about the concept of peer-to-peer crowdsourcing your healthcare, where, like many of us know, we go online to social media forums or we make support groups, and we learn from each other, like how to live through this. And if you're interested, here's some screenshots of research that support that. But without further ado, let me give it over to Susannah. And thank you for being here and your patience.
Thanks so much, Christy. And there was already a question in the chat, and that is, will the slides be made available in addition to the recording?
Yes, the recording and the slides will be made available on our website, in however many days that it will take us to get it up there. Absolutely.
Okay, great. And thank you so much. I loved the statistics that you were able to pull out. All of my research is available for free from the time that I worked at the Pew Research Center, and the work that I've done since leaving the Pew Research Center. And if you want to leave that slide up, that's actually a great slide for sort of where I'm going with my remarks. And because it introduces the 4 archetypes that I'll talk about. So you could either just go to me, or you could leave that slide up. It's your choice, Christy. And thank you again for preparing the slides and inviting me to be here. It's really a thrill. One of the first fieldwork projects that I did was in the Ehlers-Danlos community. This was, gosh, 15 years ago. And so it was a very early example of how people were able to find each other and network together. So it's a thrill to be able to come to this community and share what I've learned from this community and brought that forward into my work as a researcher, as a strategist, advising the Obama administration about how to bring the patient voice and how to bring technology and open data into the work of the federal government. And then the work that I do now, helping organizations big and small to recognize the power of peer-to-peer healthcare. So I want to begin by talking about how I just want to acknowledge most of us live our lives hoping to avoid the healthcare system. If we get sick or get injured, we want to get in and get out as quickly as possible. We hope that clinicians can get a diagnosis. We hope that it's going to be something that can be taken care of. But of course, that's not always the case. And the reality versus the hope that we see in the mainstream healthcare system, there's a disconnect. And what I realized when I moved from being a researcher, spending most of my time in communities of people living with rare and life-changing diagnoses, which is what I did at the Pew Research Center for much of the early 2000s, and then moving into these higher level conversations in healthcare at the Robert Wood Johnson Foundation, working for the federal government, starting to talk to the C-suite of healthcare. What I realized is that not everyone had had the privilege that I'd had of talking directly with patients who were suffering and in pain and living with mysteries. And so if you have a pen and paper available, I'm going to give you a quick illustration that I came up with to try and help people understand the true picture of where the gaps are in mainstream healthcare and where the patient-led revolution can help people. So I started with a horizontal line. And on the right side of the line, you can just put the words needs met. And what this symbolizes is everyone who has an issue that is easily diagnosed. It might even be something that is easily fixed, like a broken arm. It might even be something that's welcomed, like a healthy, non-complicated pregnancy and childbirth. And everyone on that side of this spectrum is getting their questions answered, and their needs are being met by mainstream healthcare. All the way on the other side of that line, on the left side, you can write needs not met. These are all the people who are asking questions that not only do their clinicians not know the answer, but maybe scientists and researchers aren't even looking into it yet. And so these are people who are having to do their own research. They may be living with a chronic illness that hasn't yet been identified. They may be, unfortunately, as we saw during COVID, they may be living with something that is emerging, like long COVID, which we now know, of course, triggers all kinds of known chronic illnesses. But long COVID was identified by patients because their needs were not being met by mainstream healthcare. Right down the middle of that axis is another line. So this is a very simple 2x2. And at the top, you can label it visible, and at the bottom, you can label it invisible. Visible is a word that I came up with that after thinking a lot about how to have empathy, not only for patients and survivors and caregivers, but I also want to have empathy for the pharmaceutical and medical device company executives who operate in a highly regulated environment and can't necessarily turn on a dime. But I want to also hold them accountable for ignoring problems that should be visible to them. And so that's why I labeled that axis of visible and invisible. Visible means that people in power see you, and they see it as their job to help you. There are lots of people who can unlock sources of power. And here I'm thinking, of course, of clinicians and researchers with all of their knowledge. I'm thinking of funders, whether it's foundation executives or investors. I'm thinking of people who have access to labs and manufacturing facilities. There are lots of people who can unlock sources of power and make something visible in the mainstream healthcare system. But down at the bottom are all those people who are living with invisible illnesses, who feel invisible to mainstream healthcare. There's something very important about this model, and that is that people themselves get to decide whether their needs are being met and whether they feel visible to mainstream healthcare. It is a bedrock belief of mine that if you don't feel that your needs are being met, then we need to listen to you. That if you are in pain, if you are suffering, if your questions are not being answered, then we need to pay attention to that. One reason I wrote my book is to shine a spotlight on that lower left quadrant. If you followed along and made the drawing along with me, where people's needs are not being met and they feel invisible to the mainstream healthcare system. I wrote my book to shine a spotlight on those people who are crowding that quadrant of suffering. And I just want to hold space for a minute and think about a time when you felt alone and when you felt isolated, or when someone you love was facing an illness and you weren't getting the help you needed as quickly as you had hoped. I also wrote my book to lift up the stories and strategies and tactics of people who started out in that quadrant, who gathered together to make noise on social media and elsewhere to raise themselves up into the upper left quadrant, where they're visible to mainstream healthcare. People start to notice and start to give research funding and attention. Their needs aren't being met yet, but at least they are visible. I also wrote my book to spotlight stories of patients and survivors and caregivers who pull themselves and their communities over into the lower right quadrant, where people's needs are being met, but they're still not visible to mainstream healthcare. And thank you. I love this illustration that you found on one of my presentations. This is an early iteration of what I eventually created for my book. And it gets to this idea of, do people empowered know how to help? Or do people empowered not know how to help? And again, I try to have empathy for everybody in this situation. And I try to think about who is currently invisible and suffering and in need of help. To illustrate how I use this Rebel Health Matrix to try and describe for people what this means, a lot of people would put diabetes in the upper right quadrant, that quadrant where we all want to be, where something is visible and people's needs are not being met. Because diabetes is a pretty diagnosable disease, and there are devices and drugs that can help people manage it. But if you or anybody you know lives with especially insulin requiring or type 1 diabetes, you know that it is a challenging daily slog. And many people living with diabetes, again, especially type 1 diabetes, would put themselves in that lower left quadrant where people's needs aren't being met. And they feel like their real problems aren't visible to the mainstream healthcare system. I'll tell a quick story about how one group of people were able to band together. I actually came up with the title for my book, Rebel Health, because of the Diabetes Rebel Alliance. And here I'm thinking of John Kostick, who was a diabetes dad. His 4-year-old was lucky enough to be prescribed a continuous glucose monitor, which is a wearable sensor that every 5 minutes tracks someone's blood sugar. It's an amazing device, but medical device companies have traditionally seen their customers as the prescribing clinicians. Not the patients, not the caregivers, the clinicians. And so they designed this device so that you actually had to be in the same room with it to see the data. This was very frustrating to a lot of people. For John Kostick, it was frustrating because he and his wife would set alarms all through the night to stumble down the hallway and peer in the darkness at their son's CGM screen to make sure that his blood sugar was in a good range. If it wasn't, they would need to take action. But thankfully, usually it was in a good range, and they would stumble back and try to go back to sleep until the next alarm went off. Well, John's an engineer, and he said, I actually think that I could get access to the data if I go in through the communication port. And so he did. He freed the data. He essentially was able to jailbreak his son's CGM. And because he's part of a community online, that a community of people living with diabetes, they were able to encourage John to share how he did it. And so on a series of social media posts, John Kostick shared how he was able to free the data from his son's continuous glucose monitor. For example, that meant that Dana Lewis, a woman living alone with type 1 diabetes, was able to build for herself a DIY louder alarm, because what she worried about is that she's a very deep sleeper. And if her blood sugar went low in the middle of the night, her CGM alarm was not loud enough to wake her up. She had written to the device manufacturer asking them to make a louder alarm, and they said, no, it's loud enough. They missed the opportunity to learn from Dana, to learn from a patient who had raised her hand and said, there's a problem that you should know about. They chose to keep that invisible. And so Dana was able to solve it for herself. Other parents took what John Kostick had done and created something called Night Scout, which is a way that peer-to-peer patients and caregivers were able to teach each other how to free the data and send it, for example, to an Apple Watch so they could stay in bed and check on their child's blood sugar. Or if you have an older child, you could allow that child for the first time to go on a sleepover or go on a school field trip without you. But you could track their blood sugar through your Apple Watch. If this sounds futuristic, it all started over 10 years ago in 2013, and it touched off a cascade of innovation. It actually opened up a whole new market opportunity for medical device companies. The FDA took notice and said, you know, this actually is going to make living with diabetes safer. It's going to make these devices more effective. And so we, the FDA, really want you medical device companies to give patients access to this data. So this is a triumphant story. They pulled themselves over into that quadrant where people's needs are being met, but only, you know, a couple hundred people at first, and then a couple thousand people. And now millions of people are benefiting from the innovations. There was also a social media campaign to draw attention to this. And so because of seekers, networkers, solvers, and champions, the diabetes community has been able to demand access to their own data and demand better products and services. Unfortunately, they stand alone. It's not true in a lot of other areas of healthcare that the patient-led, caregiver-led, survivor-led Rebel Alliance has had such success. But a reason why I wrote my book is to make sure that people know that there are maps. If you find yourself dropped into the maze of healthcare and you don't know which way to turn, there are people who would love to help you if only they knew how to find you. And being part of this webinar, I'm guessing that a lot of you already know that. And in the chat, I would love to hear what resonates with you in terms of the stories that I'm telling. I'm going to describe the 4 types of people that you'll meet in the revolution, and then we'll go to Q&A. So in writing my book, I looked back at 20 years worth of field notes and interviews to try to see if I could discern patterns in behavior. When someone gets hit with a challenge, how do they react? And what can the rest of us learn from that? So the first group that I identified and talk about in the book are seekers. And you can see on the slide, seekers go on the hunt for answers. They may have questions that they're not getting satisfactory information to answer. There's a spark that happens in a seeker where they decide to take action. And the other characteristic of a seeker that's really important to know is that they do not give up. But there's a lot of seekers on this webinar. The second group that I identified are networkers. Networkers, you'll see them in real life and online. Those are the people who raise their hand in whether it's a faith community or in a neighborhood or online on social media, who say, hey, I've got this issue and I'd love to meet other people with it. Let's gather together. Let's pool resources. Let's learn in community. Networkers are the most visible archetype of the patient-led revolution. And often when I start to talk about peer-to-peer healthcare, people say, oh, I know what you mean. Those are, I know about Facebook groups, or actually historically, Alcoholics Anonymous or Weight Watchers, or so many other radical health movements of the past were examples of networkers. They are a wonderful bulwark against the spread of misinformation and disinformation. We need you networkers on this call to understand how to fact check and only share the good information, and guard against misinformation, which is false information posted by mistake, and disinformation, which is false information posted on purpose. The third group that I identified are solvers. Solvers are people like John Kostick or Dana Lewis who see a medical device that's not working, and they can't wait to take it apart and figure out how to make it better. They are also inventors of assistive devices. And also systems. So there are some solvers that I feature in the book who look at, for example, how a clinical trial is being run and say, I actually have an idea about how you could recruit patients more quickly and keep them in the study if you design it around the patient caregiver needs. So solvers attack problems. The fourth group actually emerged as I was writing the book in my interviews with seekers, networkers, and solvers. People would often cite a single person who made all the difference to them, who were able to unlock some resource that's held by a mainstream institution that a patient-led, survivor-led, caregiver-led organization couldn't get access to otherwise. Champions can get people access to, for example, funding, media attention. A journalist could be a champion. Access to labs and manufacturing facilities, or regulatory guidance. There are many resources that a patient-led team will need to help take a scrappy new idea to scale, and that's what champions can do. So often when I'm talking to healthcare executives, I talk about how on a professional level, you are going to want to partner with the rebels of healthcare because they can actually expose new market opportunities for you. They can help you get your work done faster. They can help you accomplish your goal. I say the same thing to my friends in the policymaking world. When I'm speaking to patient groups, I talk about how you don't have to do this alone. You don't have to become a seeker, a networker, a solver, or a champion. If you naturally go toward one or more of those archetypes, awesome. Share your skills, teach other people about how to do what you do, but also know that if you are too exhausted, if you don't have the spoons, you can ask for help. You can recruit other people to your team so that when you have a question, recruit, that cousin, that neighbor, that nurse who's your friend to be that seeker for you, or to be the networker and ask the question, or share what you've invented. So with that, I'd love to hear from people about what has resonated with you. If you have questions about anything that I've shared. And I also have lots more stories. So if people want to hear more stories and more examples of how people fight their way out from that quadrant, I'll let Christy take over and ask questions.
Great. Thank you so much. And so inspiring that you've, found this commonality of a pattern of people that are, figuring out how to make the world a better place. So if you have questions, I know we have a couple. So if you have questions, please put them in the chat. We'll take them live. And I see some raised hands. I'm sorry, we're not going to take raised hands as a mechanism today, but let me go back and check out the chat.
I see one, and I'll read the question. Could you please say the name of the branch of the diabetes revolution and what they called themselves? So one term that they use on social media, and this really started on Twitter, and then has moved to other platforms. They call themselves the Diabetes Online Community, or the DOC. And it's in talking and in interviewing them over the years that I started thinking about them as the pioneers building on the frontiers of healthcare. And we started sort of talking like almost in Star Wars terms about like the Empire and the rebels. And so this idea of the Diabetes Rebel Alliance kind of emerged as I was talking with the patient advocates who are part of the DOC, part of the Diabetes Online Community. And actually, I'll share Ben West, who is someone who's a solver, He was part of the early Night Scout movement. He lives with type 1 diabetes, and he helps people peer-to-peer figure out how to create the kinds of tools that they need to track and take care of their diabetes. He was really frustrated that the medical device company that makes his insulin pump, they wouldn't give him the protocols, and he's an engineer, and they wouldn't basically give him the manuals for understanding how his insulin pump works. And so he and his sister and his dad took the insulin pump apart on the living room floor and reverse engineered it so he could figure it out. And he shared what he did online. And actually, Dana Lewis, who did the DIY louder alarm for herself, she, along with her now husband, Scott Librand, and Ben, worked together to create a do-it-yourself open source artificial pancreas system. And Dana has just gone on to create incredible advances in terms of the science and understanding of a patient living with diabetes. But that's an example of the diabetes online community coming together in real life and making those changes.
Yeah, so there are other questions that you can see here are, are you familiar with the profession of like patient navigators or patient advocates? And this person is asking specifically in the oncology space.
I sure am. They are amazing. And they are an example. Patient navigators are an example of booster rockets that you could put onto the care that you or a family member need. They can help, they literally help you navigate through the choices that you need to make in a complex situation that can feel very fast moving. A patient navigator can say, okay, we can slow down for a minute. You actually don't need to make a decision today about care that's going to affect the rest of your life. They're the kind of people who would know what to do in that situation. And they are especially powerful in oncology. What I don't write about them in the book. Patient navigators often come from a place of lived experience and get their training because of their own lived experience, and that's incredible. What I wanted to spotlight is less of the professional work that happens so far, but more of what's bubbling up from the grassroots that people don't yet see, that hasn't yet been recognized. But I love patient navigators. There's some awesome ones, especially on social media. If you want to share, Christine, if you want to share some of the names that you know about of people to follow as examples, that would be awesome.
Yeah, I was going to say I can put some of that in the chat, but as many of you know, it's hard to find providers in the EDS space, but there are a handful of EDS, advocates or patient advocates who are EDS aware. And one of the best things to do is there are directories of patient advocates where you can search either by diagnosis or by like, I'm looking for a nursing home for my parents and things like that. And so I know that there are several on there. I'll try to look them up and post them in there. But if not, Google, like directory of patient advocates. And, there are people on this call that do that sort of work. And we all, kind of share names and work together. But there is no kind of like single resource to, go and identify EDS advocates. Some of you may know of Maggie Buckley. She's one. Gosh, it's a rare beast, but they can be helpful. So one of the
Oh, go ahead. Go ahead.
No, it's okay.
Well, so when you mentioned that there's no directory, it reminds me of one of the most common questions when I speak to a group like this or a general public group about my book. So often a question comes up of, where do I find a community? And people come to like a bookstore event where I'm speaking and they say, great, I'm in, like, I want to join the revolution. How do I find a community for my condition? And this again is a gap that needs to be filled of how do we find patient navigators? How do we find patient-led, caregiver-led, survivor-led communities that we can trust? What I usually say is when you're looking at communities, wherever you find them, look for communities that are vibrant, look for communities that have a lot of conversation going on. There can be an amazing community on an open platform like Reddit. Twitter used to be a wonderful place with certain hashtags. And by the way, I'm going to stay on Twitter for as long as it is in existence because of my friends in the ALS community who say that Twitter is the easiest to use with eye tracking software. And so look for places that are very vibrant and have lots of conversation, even if it's a small membership. But sometimes really powerful communities are kind of hidden. They can be in private Facebook groups, and we don't have a directory. Just as we don't have a directory for patient navigation, we don't have a directory for online communities, and we really need it.
Yeah, so I shared in the chat one of the, advocate directories that are for what they call independent health advocates. And there's probably some advocates on this call, and the definition of that is when that advocate, like you hire them or your family hires them and they work for you. And so they are looking out for your best interests, which is different from like a patient navigator in a hospital or a patient advocate at your insurance company who gets paid by someone other than you. So as you're looking around and doing this, just be conscious and make sure that you're aware of like who's paying their paycheck and and whose best interest they're looking for, because they might steer you in a direction that's more beneficial to them, or a surgery that's not really what you need, but it's cheaper. So be aware of that sort of thing. And people that are certified by the BCPA are people that you definitely want to ensure that you're getting somebody that has their certification, has been through the training. It's a growing profession to be a patient advocate because of this need that Susannah's talking about, where people that are leaving the healthcare industry, like nurses, are becoming patient advocates because they know how to work the system and they're frustrated with, being inside of it and are helping patients navigate it through. Another resource that I hope most of you are aware of is on EDS Awareness. One of the greatest resources that John Furman has put together is a section of the website where not only can you search and find support groups like geographically or, however, but if you're someone who wants to start a support group, there's a full kind of training and educational program on, these are the things that you should set up and like the recommendations of how you run this. And, here's how to set up a Facebook group and etc. So he's really pioneered putting people together through the Chronic Pain Partners website. So I'm going to go on to make sure that Erica, who is having challenges typing, and I apologize, will.
And she persevered and typed
Yeah.
the question. And Erica, do you want to add to the question that you put in the chat?
Thank you so much. I'm trying so hard to listen and to formulate the question. I really appreciate it. And you actually led to it. So the question is just being kind of new into this movement, as a not yet late diagnosed seeker and networker and a number of things. Can you speak? I did try to put it into the written format. Can you speak to what you've observed in other movements about carefully and mindfully moving from the current very localized and decentralized and not connected? So like connecting the networks, and like what could we think about or learn, or what do you see looking across the board at different movements might be helpful in the EDS community at this stage to help us gain momentum? And I hate to say the word centralize, because there's so many ways in which the voices can be lost. But yes, I think the layers that I'm getting at, like how do we kind of find a voice with more momentum and clout, and not necessarily unified or centralized, or maybe mindfully so, but what do you see for that trajectory
I
of or
love it.
organizationally? Thank you. Thank you. Thank
Great
you for including me,
question.
Christine. I appreciate it.
Great question. And I loved the way that you put it in the chat, the evolution of the revolution. And one of my favorite parts of writing the book was diving into the last 100 years of radical health movement history in the US. And like, I'm enough of a nerd that I was like, oh, I want to do like one for every country. Like, I want to go back further. But I just limited myself to the last 100 years of radical health movements. And I started the book with a timeline. And I did that to try to situate ourselves in the fact that this sense of isolation, this sense of invisibility, this reality of needs not being met happens because of stigma, because of discrimination, because someone is dealing with something that is fast moving. And so I love to look at the history of a radical health movement, and I'll give a couple examples, so that those of us today who are hoping to have the kind of success of our revolutionary forebears can borrow the playbook that we need. So that we know also that we're stepping into a long line of people who have demanded access to data, or if the data did not exist, they built it themselves. So, for example, one of the organizations that was radical at the beginning and now is part of mainstream culture was Alcoholics Anonymous, founded in 1935 because alcohol use disorder was stigmatized. Mainstream healthcare didn't have anything to offer, and so people turned to each other to manage their sobriety, famously one day at a time. And now it's really part of peer support is now it's part of U.S. policy. It's it's part of everything that people think about in terms of addiction recovery and substance use disorder. I'm thinking also of the Black Panther Party in 1971, which recognized that no one was tracking the prevalence of sickle cell anemia in the United States. And so because they had created a network of community health centers, they created a community-led data collection initiative that was the first data registry for sickle cell prevalence in the US. As hopefully most of you know, this is a genetic disease that's mostly people of African descent. Where the federal government failed, peer-to-peer healthcare stepped in. That's a situation that we saw actually repeated in the COVID, in the emergence of long COVID, that nobody was tracking long COVID as it was emerging. And so it was patients themselves who collected the data to prove that this exists, that they named it, they tracked it, they collected the data, and they published that data that's then been cited over and over again, and got the attention of the World Health Organization, NIH, the UK Parliament, et cetera. That's the kind of community-led data collection playbook that we can draw from. The other playbook that a lot of people talk about is ACT UP. So another fast-moving virus sweeping the world in the late 1980s, stigmatized because illness first emerged among gay men. ACT UP is a super, super interesting model because each chapter of ACT UP operated completely independently. there was no central organization. And so each one could take the actions that they thought were needed in their area. And it was a peer-led coalition that would famously, have very public actions to draw media attention. There were others that would privately be lobbying NIH and FDA. So even as they were chaining themselves to the gates of FDA or creating disruptions, there were also people meeting with Dr. Fauci back in the day. And he listened to those peer-led advocates who, again, had collected data about a certain treatment that they'd heard about. And ACT UP was able to change the way that biomedical research and policymaking happened. And it was the ACT UP playbook that was taken by the National Breast Cancer Coalition. They basically used a very similar playbook mindfully to use this combination of getting media attention and collecting data and demanding a seat at the table. That's what these successful evolution and evolutionary revolutions, to use your phrase, that's what they've been able to do. So I think it really depends on what you're trying to accomplish. And you'll need different playbooks to accomplish different goals. But there's like just an awesome, I wrote a post on my blog and on LinkedIn of all the books that I read to prepare for writing my own book. And I listed some histories of radical health movements of the past that would be a great place to look to begin thinking about what playbook you want to pull down from the shelf.
Yeah, as you are familiar with the Ehlers-Danlos community, we're kind of in that, I'll call it infancy stage of, people starting to recognize that other people are out there and they're on community forums, and there are seekers and networkers putting things together and trying to share and collaborate. People like John who are forming nonprofits, and, other people who are doing podcasts to share information. And, there's certainly a recognition that there's such a need for this. When I published my book about hypermobile EDS a couple years ago, it rocketed to like the #1 spot on Amazon bestseller in my category. And I'm a nobody author. And it had nothing to do with my book or my writing. It's the need in the community that are starving for resources. And so, one of the things that I do personally is, volunteer for places like Chronic Pain Partners to try to share information. Or I just started something with some other partners where, we have like an Ehlers-Danlos share collaborative newsletter, and that has formed into like a tech tool of thousands and thousands of resources that are related to EDS. And you can check that out at it's an app, but it's not like on the App Store, but it's at app.eds411.com. And it's just an example of people coming together, to put forth little efforts. And the thing about that tool is anyone can add to it. So like collectively as a community, we can all start saying, hey, I learned this, or hey, there's this research. And we start to collaborate and connect things together, just like she's talking about. So it's quite a beautiful thing when these communities come together. And I imagine it's been really interesting for you, Susannah, to take a look and watch these things. So can you give us any examples of, you've talked about oncology and diabetes and things, but is there anything that you're aware of that kind of fits in this EDS sort of full body connective tissue? The silos in healthcare can't help us connect things together. Like how do we get each other organized around like everything that's going on?
Yeah, I appreciate, Erica, your follow-up question about like, so what are some next steps that we can do right now? And I'm thinking about the importance of allyship, because indeed you're a community of people with, you run out of spoons and that's it. Like, and I saw another comment about people are often also caregivers. So I'm thinking of ways that you can create allyships with other people in communities that are like you or parallel, and create a coalition. I also think, picking up on the idea of caregivers, there is I perceive a growing awareness that care is infrastructure. And there's more public discussion of the care economy, and how the importance of caregivers. And so thinking not only of yourselves as a patient-led movement, but bringing in this idea of you're part of the care movement as well. And drawing in resources that are available for caregivers, that are available at the state government level, that are available. Caregiving is often associated with aging, that people in their mind's eye think of, resources that the state agencies on aging, or AARP. And I would say, if you're a young caregiver, don't shy away from accessing the resources that are available for what looks like it's going to be for silver foxes. Like, it's something that like the AARP has an extraordinary set of resources for caregivers that this community should tap into in terms of toolboxes and other things. I'm trying to think, did that answer the question, Christy? Did I get to all the aspects of your?
Yeah. It's the question of, how do we do this? Where do we go? Where do we start? And, that's one of the main functions of chronic pain partners, is to try to bring people together. And, there's other nonprofits that are also doing this, that, we're going to give you information and research news and tell you about, maybe it's a product that's helpful for some of our symptoms, but it's bringing all of us together and collaborating. So yeah, I mean, it's very hard. It's not easy, but a lot of these nonprofits and these sites are working really hard to share information. And I'm hopeful that in the, years to come, or next decade, that a lot of this patient-led movement by people that are personally impacted by this and frustrated are going to help drive decisions in, whether it's medical testing, or diagnostic improvements, or treatment improvements. If you're in the EDS community, you're familiar with Dr. Courtney Gensimer, who is a patient, who is a scientist and a researcher, and she's driving, a movement of, let's figure out how to make a diagnostic test. And there are people out there doing that in our community. Some of the best ways to find them is to go on social media. Like Facebook has more groups, and Instagram is more kind of like imagery and photography related. But whether you're young or old, if you go to Facebook and you search, the different variations of EDS or Ehlers-Danlos or hypermobility or whatever it is, and look in the groups category, there are hundreds, maybe thousands. So find one that's in your geography or that has a lot of members and looks interesting, and just get engaged. So let's see. I have another question from Erica, and thanks for typing. She, like many of us, wants to have time to be able to participate in these groups, when you're trying to take care of your health. And, getting out of bed, of taking a shower is an accomplishment. We don't often have time to be on these. So sometimes you might be able to sign up for like newsletters and things like that to be able to feed it to you. So if you're not already on like the Chronic Pain Partners newsletter or the EDS Share newsletter, be sure to do that.
Well, I'll add one thing, and that is, I saw somebody else mention that we not only need to lift up the lessons from the successful campaigns, but we also need to learn from their mistakes. And an organization that's been amazing at sharing their mistakes is IMALS. They have a whole section of their site of the playbook and mistakes they made in starting their organization. And I think making sure that you know that you're not alone, you're not the first group that has tried to organize and tried to create change in the world, and knowing that you as a person, as an individual, don't have to tackle this whole thing. You can do something that you know how to do and figure out ways that you can contribute. And collectively, it's such a large group of people that lifting your voices, you have to be heard. And it's really an honor to come and be part of your community today. Thank you again.
Yeah, thank you so much. So, what do you see as like the biggest barrier in healthcare today for this kind of marginalized, unmet needs groups like EDS and several others?
Well, for this group, my understanding, you could probably name it. It's diagnosis, and no, and then as soon as you have diagnosis, being able to access appropriate treatment. A barrier that I think is universal is appropriate access to information that I feel like no conversation can go by without somebody talking about AI. And so I'll bring in AI and we can check that off the bingo card. At the beginning, we a dog barking, that's part of the Zoom bingo, and now AI is, you can check that off for your bingo card. I'm super excited about the possibility of democratizing access in every language at every reading level to the best scientific and crowdsourced information about living with health challenges. That if we can make sure that everyone everywhere is able to get access to information in their language at the reading level that they need, I think that will remove a lot of barriers, because once you know what the challenge is, you can hopefully then take action, and start taking care of yourself and recognizing where you need to place your energy.
Yeah, energy conservation and where we put it. It's a tough lesson to learn in chronic illness, but it's critical.
Hey,
So
I have a quick question for the group, and I realized I should have asked this earlier. Is anybody using an app like Visible or Bearable? Because I'm thinking about writing about those apps, but I realized that I would be remiss if I don't ask this group if anybody's using it,
so
any app. I just named Visible and Bearable.
yeah, while we wait for people to put their comments in, I know, there are several apps out there, and it's like there's symptom tracking, and then there's data management for your medical records, and like contact management and calendar management for your doctors. And it's like, how do you find one that kind of are doing all these things? And that's really a challenge. If a bunch of us had the money, we would try to design one, and get some VCs interested in trying to meet this need. The closest thing that supports a lot of our needs that's sort of newer in the space and critically important, it's free, is an app called Guava, Guava. It allows you to track your symptoms, and it helps you identify patterns and show it and share it with your doctor. Because when you go in with the doctor, when you have data to say, look, this thing is happening every other day, and here's the evidence. Some of the other tools, people use, like you said, I'm drawing a blank. I'm having a brain fart moment. But
No worries. And
but
thanks everybody who's putting the comments in the chat about Calm and Curable. I'll look up Guava. That's awesome. And just because I know we're running out of time, I see a question about some of the successful companies like Equip and IMALS and Synapticure, and how they were able to meet success. And one of the reasons is that I'll speak quickly about Equip, which is an eating disorder recovery company. It grew out of a survivor's own passion that she had access to the best care, and not everybody does. And so she created a company that would democratize access to the best of eating disorder recovery, which includes, by the way, peer coaching. It's a virtual first company. And she had a champion in a United Health executive, probably the biggest health insurance besides the government, maybe bigger than the government at this point, is United Healthcare. And there was an executive who had a child with an eating disorder. And so, it's that lightning strike of like, okay, Michael J. Fox has Parkinson's. That's going to transform Parkinson's. This healthcare executive was able to get the founder, the CEO of Equip, into the halls of what, the empire, frankly, of United Health, and make the case that this was going to save money in the end if they treat eating disorder recovery, because it really does. And Christina, the CEO and co-founder, was able to collect data showing that the company was effective and less expensive than traditional inpatient treatment. And she found a champion in a healthcare executive. So that's that story.
Great. Do we have any more questions? I know we're running a little bit over, and thank you all for joining us. For those of you that are going to watch this on replay, thanks for watching. Thank you so very much to you, Susannah, for your time, your
pleasure.
energy. And also thanks to, John Furman and all of the people that volunteer to make the things that EDS Awareness and Chronic Pain Partners are sharing. Thank you for being those seekers and networkers and champions. There are a lot of people out there who have found you, and you're helping them, and your impact to them is more than you'll ever know. So thank you to all of you. I hope that you can be well, enjoy a good weekend, and take good care of yourself. Thank you.
Thank you.
Thank you.